Hello, welcome to the Seasonal Affective Disorder presentation. My name is Pamela Krutkiewicz, and I'm the Senior Health Promotion Specialist at SumaCare, and I will be your host. During this presentation, we will learn about seasonal affective disorder, or SAD, by learning what the disorder is, the causes, the common symptoms, and how to manage the disorder. Here are the 8 dimensions of wellness. While all dimensions of wellness need our attention, there doesn't have to be balance among all dimensions at a given time. Instead, the goal is to find harmony with the dimensions that are most authentic to you in the moment. This presentation will focus on the emotional, physical, and social domains. The emotional domain focuses on our understanding of ourselves and the ability to experience and cope with feelings independently and interpersonally. The physical domain focuses on adopting healthy habits and avoiding or minimizing risky behaviors. And the social domain focuses on connecting with your community and the people around you by connecting with others, establishing supportive social networks, developing meaningful relationships, and creating safe and inclusive spaces. Imagine waking up each morning feeling like a shadow of yourself, struggling to find enough energy to face the day. SAD typically occurs during the fall and winter months when daylight hours are shorter. People experiencing SAD may be unable to work, go to school, and maintain responsibilities at home. Their relationships may struggle, and their attitude may be undesirable. They may feel the urge to stay in bed most of the day and hibernate. Some people experience SAD during the spring and summer months, but this is a very rare occurrence. While SAD may emerge at any age, most cases do not begin until adulthood, so children with the condition will be rare. SAD creates a pattern where the weather and seasons demonstrate predictable and consistent mood changes caused by that change in season. What is the science behind SAD? SAD is linked to reduced sunlight exposure, which can impact the body's internal clock and disrupt its natural circadian rhythm, which regulates sleep-wake cycles, contributing to fatigue and mood changes. Sunlight exposure helps the body produce vitamin D, which is essential for mood regulation. Reduced sunlight can lead to vitamin D deficiency, potentially worsening symptoms. This often leads to a drop in serotonin, which is the feel-good neurotransmitter, and an increase in melatonin, the hormone that promotes sleep. Together, these changes contribute to fatigue, irritability, and sleep disturbances. People who are diagnosed with SAD will often present as mentally healthy during the spring and summer months by being physically active, more social, more energetic, and display signs of happiness. However, in the fall and winter, the effects of the spring and summer give way to low mood, worthlessness, low energy, and other unwanted symptoms of depression. While feeling a little down during winter is common, SAD symptoms are more severe and persistent. Here are some key signs to watch out for. Low mood and depression, feeling down, hopeless or irritable for most of the day, nearly every day. With irritability or agitation, some people experience a loss of interest in activities or a lack of motivation or enjoyment in activities they once loved. In addition, there is typically a change in their sleep patterns with the onset of oversleeping or difficulty sleeping, leading to fatigue during the day. Changes in appetite and weight, increased cravings for carbohydrates, overeating, or weight gain. Low energy or lethargy, feeling sluggish and lacking the energy to get things done. Difficulty concentrating and focusing on tasks or making decisions. And social withdrawal, isolating oneself from friends and family In some instances, people may experience thoughts of death or suicide. It's important to note that these symptoms can also be associated with other types of depression. If you're experiencing several of these symptoms for an extended period of time, it's crucial to consult a mental health professional for a proper diagnosis. If you or someone you know is in immediate distress or is thinking about hurting themselves, please call or text the Suicide and Crisis Lifeline at 988. Seasonal affective disorder and the winter blues tend to become interchangeable because they are both negative emotional experiences affected by the shorter days of the winter season. It is very common to mistake one for the other and may even be difficult to differentiate when deciding whether to talk to a healthcare provider. People may notice that as the days get shorter and there is less daylight, they may start to feel sad. Let's try to differentiate the winter blues from seasonal affective disorder. The first step is to determine how much your symptoms interfere with your daily life. With the winter blues, we see the following: mild symptoms that last less than 2 weeks, feeling down but still able to take care of yourself, having some trouble sleeping, having less energy than usual but still able to do and carry out daily living tasks. There are activities that can make you feel better. These may include doing something you enjoy, going outside into the sunlight, spending time with family and friends, and eating healthy or avoiding foods with a lot of sugar. If these activities listed above do not help your symptoms or are getting worse, talk to a healthcare provider. With SAD, we see the following. Take note if you have more severe symptoms that have lasted more than 2 weeks: social withdrawal, oversleeping, gaining weight, craving foods with lots of sugar like cakes, candies, and cookies. If this is the case, please seek professional help. Professional help may include light therapy, psychotherapy, which is a talk therapy, medications, and vitamin D supplements. You don't have to suffer through SAD and wait for warmer weather. Instead, consider evaluating one of several treatment options with your healthcare provider to reduce your diagnosis of SAD. Let's review 5 preferred methods to treat SAD. The preferred method of treatment for SAD is light therapy. Light therapy is a simple, safe, and effective method of replacing lost access to sunlight. For this reason, once you replace the light, you should start feeling better. The light mimics sunlight and helps reset your wake-sleep cycle. To avoid light interfering with sleep patterns, a light box should be used first thing in the morning, and it should be used for 20 to 30 minutes at a time for best results. Although light boxes are safe and effective to use, they are generally recommended only for those who have been clinically diagnosed with SAD. It's best to talk to your healthcare provider before beginning this type of treatment. Exercise produces feel-good chemicals like serotonin and endorphins, which can help fight depression. While exercise in a gym can be extremely helpful, getting outside for a quick run or a walk around the block can be beneficial. If you aren't into lifting weights or taking part in an exercise class, consider adding 30 to 60 minutes a day of walking into your regular routine. The important thing is to keep moving. Medication. Antidepressants are often an effective way to help combat SAD, especially if the symptoms are severe and other methods of treatment aren't working. Medications are also helpful if you are experiencing other forms of depression in addition to SAD. Discuss medication options with your healthcare provider including vitamin D supplements. Some evidence supports the use of cognitive behavioral therapy for coping with seasonal depression. Cognitive behavioral therapy helps people identify negative thoughts and replace them with more positive ones. Individuals are taught that depression from SAD is not a choice, but an innate part of their behavior. As a result, the individual is taught to refocus negative energy by reading a book, spending time with friends, journaling, or taking up a new hobby. Make healthy lifestyle choices. Depression can often make you reach for unhealthy methods of coping, such as overeating, choosing junk food over healthy foods, staying up too late, and drinking alcohol. When coping with SAD, start by eating a healthy diet, cut out sugar and caffeine, and abstain from drinking alcohol as much as possible. Last, be sure to schedule a regular checkup with your healthcare provider. Consider relaxation techniques such as yoga or meditation, and be sure to get a good night's sleep every night. When left untreated, SAD can result in long-term negative effects on your quality of life. Complications may include increased and sustained social withdrawal or relationship conflicts, issues at work or school, such as frequent absences or decreased productivity, issues with substance abuse, development or worsening of other mental health conditions, such as anxiety or eating disorders, and last, suicidal thoughts or behaviors. Once you recognize any signs or symptoms of SAD, it is important to reach out to your healthcare provider for a proper diagnosis and discuss treatment options to help avoid complications. So let's review statistics and facts. January and February are the months people with SAD struggle the most. The further you go north in the United States, the more common SAD is. For example, SAD is 7 times more common in Washington state compared to Florida. Roughly 5% of U.S. adults experience SAD and say it lasts 40% of the year. SAD can begin at any age, but typically starts between the ages of 18 and 30. More than 500,000 people in the U.S. suffer from SAD. 10 to 20% may suffer from a mild form of the winter blues. 3/4 of those suffering from SAD are women. Many people with SAD report having a close relative with a mental disorder such as severe depression, which equates to 55%, or alcohol abuse at 34%. Lake effect. 5 of the 10 cities with the most depressing winters are located downwind from one of the Great Lakes. This causes sunlight to be a rarity in the winter. Grand Rapids, Michigan, Buffalo, New York, Syracuse, New York, Cleveland, Ohio. Behind Grand Rapids, Cleveland is the second cloudiest city in the Midwest. And like Buffalo and Syracuse, it sometimes gets caught in Lake Erie's shadow, leading to extra cloud cover and snow. And last but not least, Rochester, New York. Arizona, Florida, and Hawaii have been found to have the sunniest winters, making them easier for those with seasonal affective depression. So what is the take-home message? SAD typically occurs during the fall and winter months when daylight hours are shorter. People experiencing SAD may be unable to fully function. People may not be able to function or go to work, school, or manage responsibilities, which may cause relationships to struggle or thrive. They may also choose to hibernate. SAD is linked to reduced sunlight exposure, which can disrupt a person's natural circadian rhythm that regulates their sleep-wake cycles, contributing to fatigue and mood changes. Sunlight exposure helps the body produce vitamin D to regulate your mood, and it regulates 2 key hormones, serotonin to make you feel good, and melatonin to promote sleep. Seasonal affective disorder and the winter blues are often interchangeable because they both produce negative emotional experiences affected by the shorter days of the winter season. The types of symptoms each present are the key. Light therapy, exercise, medication and supplements, cognitive behavioral therapy, and healthy lifestyle choices are good options to help with SAD if you are diagnosed. Once you recognize key signs or symptoms of SAD, it is important to reach out to your healthcare provider for a proper diagnosis and to discuss treatment options to help to avoid possible complications. Here are the SummaCare resources. Please review your plan documents for access. We always encourage an annual visit with your primary care provider. We offer condition and care management programs. We provide guidance if you are diagnosed with a chronic condition or have complex needs. We offer telephonic health coaching for lifestyle behavior management. You may have access to WebMD Health Manager, which provides health education, trackers, goal setting, and a health assessment. This is located in SummaCare's Plan Central platform. You have access to a 24-hour nurse line in which SummaCare nurses are available 24/7, 365 days a year for any of your medical questions or concerns. You may have access to Teladoc Health, a telemedicine feature while traveling or in need for minor medical issues or concerns. We offer our Quick Care Smoking Cessation Program, which is a telephonic coaching program, and you are offered limited nicotine replacement therapy. And you may have access to Husk Health and Wellness discounts. This gives you access to discounted health club memberships, nutrition programs, and educational resources. Here are the resources that were used to help present this presentation. Thank you for your time and be well. And as always, follow SummaCare on any of the social media platforms listed below.